How is a prostate biopsy performed? Have you ever wondered how doctors check for prostate cancer? One common method is a prostate biopsy. This procedure helps doctors gather small samples of tissue from the prostate gland to look for cancer or other issues. Let's break down how a prostate biopsy is performed, step by step. First, preparation is key. Before the biopsy, you might be asked to use a small enema about 30 minutes prior. This helps clear your bowel and rectum, making it easier for the doctor to see the prostate during the procedure. To lower the risk of infection, antibiotics are usually given beforehand. You may also receive medication to help with pain and anxiety. Local anesthesia or sedation can be used to make you more comfortable during the biopsy. Next, let's talk about positioning. For a transrectal biopsy, you will typically lie on your left side with your knees bent toward your chest. The doctor will perform a digital rectal exam to feel the prostate and check for any abnormalities. Then, a lubricated ultrasound probe, covered with a protective sheath, is gently inserted into your rectum. This probe helps visualize the prostate on a screen. Now, onto the ultrasound imaging and guidance. The ultrasound probe provides real-time images of the prostate. This allows the doctor to guide the biopsy needle accurately. If you have had an MRI scan, those images may also be used to target specific areas of concern within the prostate. When it comes to tissue sampling, the doctor uses a spring-loaded biopsy needle. This needle is inserted through the wall of the rectum into the prostate. Typically, about 10 to 12 small tissue samples, also known as cores, are taken from different parts of the prostate. This helps improve the accuracy of the diagnosis. The needle is inserted multiple times, each time quickly taking a small core of tissue. The entire procedure usually takes around 5 to 10 minutes. In some cases, a transperineal biopsy may be performed instead. This method involves inserting the needle through the skin between the scrotum and anus, rather than through the rectum. Patients are often in the lithotomy position, lying on their backs with their legs raised. More tissue samples, around 14 to 22 cores, may be taken to ensure thorough coverage of the prostate, especially for larger glands or specific lesions. While this approach may have a slightly higher risk of urinary retention, it can reduce the risk of infection compared to the transrectal method. After the biopsy, you may need to wait until you can urinate to ensure that any swelling of the prostate is not blocking urine flow. It is common to experience mild pain, blood in urine, stool, or semen, and some minor discomfort after the procedure. The tissue samples are then sent to a laboratory, where a pathologist examines them under a microscope to check for cancer or other conditions. In summary, a prostate biopsy is an important procedure that uses ultrasound imaging to guide a needle into the prostate to collect tissue samples. Local anesthesia and antibiotics help minimize discomfort and reduce the risk of infection. This procedure is quick and essential for accurately diagnosing prostate cancer. Always consult with your healthcare provider about the best biopsy method for your specific situation and any necessary preparation or aftercare.